Hey, I'm Shaun Fix. I'll be one of the people presenting at CLINCON this year. I've been involved with CLINCON since 1989 for 10 years as an ALS team competitor, and since then on the ALS competition committee. I've also been a presenter for the conference off and on since 1994. I'm going to tell you a little bit about what I'll be presenting this year. I grew up in EMS and fire rescue in Florida, though I speak around the country. In 1983 and 84, while going to paramedic school, I worked in Levy County and Alachua as an EMT and a firefighter. I spent the next 4.5 years with St. Lucie County Fire Rescue, and for the past 26.5 years, I've been with the city of Boca Raton, where I currently work as one of the field EMS captains. So I plan to put a Florida spin on everything that I speak about. So over the 2 days, I'll be presenting several programs. On Friday, I'll be doing a couple of things. In the morning, I'm going to be talking about management of the violent patient and self-defense. This is kind of a scaled-down version of the 4-hour hands-on skills lab that we do, an introduction, if you will, to being attacked, avoiding being attacked, and what to do if you are attacked. In the afternoon, I'll be doing 2 lectures. I'm going to speak about tips and tricks for the difficult intubation. I realize that intubation has been a controversial skill over the last several years, but this lecture is specifically going to talk about how to get the tracheal tube into the trachea in those patients that you cannot get on your belly, get on the floor and intubate, or put on the stretcher and intubate while they're laying supine. So it's really just going to be talking about the ALS provider and how to get a tube into the trachea. After that, I'll be talking about malignant hyperthermia. So this is a new lecture that we talk about based on some experiences we have. I realize that most of you who do paralytics in your system have some knowledge about malignant hyperthermia, but I'm going to talk about this from the angle of if you respond to a surgery center where they have a case, which is the more likely culprit that we would have, what to expect, what to think about, how to recognize it, and how to incorporate yourself into that team to provide the best patient care. Saturday, I'll be speaking about a lecture I call Special Arrests for EMS. This is a think outside the box, critical thinking review of managing cardiac cases when you're a paramedic who has to do cases from start to finish. So it's kind of an outtake of ACLS, simple, here's VFib, here's a couple shocks, here's a couple of meds, and the patient gets better. What to do when the patient doesn't get better, what to think about in the patient who is not being resuscitated, and what other tricks we might have up our sleeve that we can look at to help us increase survival rate. The second lecture I'm going to do is on pediatric airway management. Again, another controversial subject, and I'm going to talk about various ways to manage the pediatric airway, from basic bag valve mask ventilations through positioning, paralaryngeal airways, and again, I'll talk about intubation in this group as well. Don't forget to check out the International ALS and BLS competition right before the conference starts. See some of the best teams in the world compete at the ALS level, BLS level, and student teams at the Bill Shearer International competition that has made CLINCON famous since the 1970s. See you there.